So the fact that there is so much misinformation out there about, health and wellness, and there are a lot of people who have some significant chronic illnesses and maybe feeling like hopeless. I can't do that. I can't fix this. There's nothing that, kind of feeling helpless on what they can do. I think there are some general principles that apply to most people when we think about healthy habits and change, but the way we achieve those things can be very unique. So that way, you can make these changes in a way that kind of honors your goals and your values without having to do something that doesn't feel, quite right to you. And I feel like we have this one body, this one life, and try to take care of it in a way that feels good to you.
Hello, everybody. Welcome to Health Transformers. I'm Becky Longacre, your Nurse Gone health coach. And today I am very happy to be interviewing a fellow nurse and a nurse that has gone on to be a nurse practitioner, Amy Brown. She is the owner of Mainly NP Primary Care. Is that the correct title? Is that exactly
correct?
Right?
Yes. Yep.
And it's right in Maine. She has been a nurse practitioner for 15 years. And before that, she was a nurse for 4 years. So she has plenty of experience to bring to the table in terms of, where we have come from our healthcare system and potentially where we would love to go. The point of this podcast interview is to talk to other healthcare professionals that are honestly trying to break the mold a little bit to create change in our healthcare system so that we have better patient outcomes in the future. So welcome, Amy.
Great. Thank you so much. I appreciate you having me.
All right. So tell me a little bit about your experience in the current healthcare system. What's working and what's not working?
Yeah. So as you said, I've been in the healthcare system for about 19 years. And, during that time as an RN, I worked at the bedside in a variety of settings. I did my standard surgical assignment, sort of the first year out of nursing school, which was at that time the expectation. When you graduated, you had to get a year in of med surg. Yeah. And then, I got some experience in the cardiology unit in the emergency room. And so just kind of had a broad array of experience. And while I knew I wanted to go on to be a nurse practitioner, like as a teenager, it was something that I was thinking about. Once I was out and nursing at the bedside, particularly in cardiology, you see the same sick patients over and over with congestive heart failure and MIs. And, I just began to feel like, well, isn't there something we could be doing to prevent these things, which of course, those providers were trying to do already, but the time that we actually are able to give to those types of services is just really minimal when we think about being in the primary care world, or even in specialty care. Cardiologists, they're treating people who are so very sick that, yes, we're going to talk about nutrition and salt and exercise, but some of those patients, they're working so hard on other things to keep them alive, to keep them functioning, that becomes kind of the bottom of the barrel when they're going through those interactions with patients. So that was sort of a point where I was like, okay, I think, it's time. I'm gonna go on to get my NP and kind of be on the other side of the care when we're working together to prevent illness, to promote health, to work with families. I like the idea of taking care of, the kids, the parents, the grandparents, the aunts and uncles. That kind of community aspect of primary care really interested me and still does. And so that was kind of the transition there for me. And then I've spent almost my entire 15 years as an NP in primary care. And so while I have loved, pretty much all of my time, I have definitely had periods of burnout. Because our healthcare system, it doesn't work for our patients, it doesn't work for our providers, and so the provider feels like they're giving everything they have, or at least this is how I have often felt, where I'm really just giving all of myself but that my patient isn't necessarily getting better outcomes, even though I'm
Yeah.
giving so much.
Yeah.
And my patients may be feeling like I'm trying so hard and I'm still not getting the outcomes that I want.
Yeah.
And so I think a big part of that is the system we're in and the for-profit insurance companies that we all work for. You know,
Yeah.
those companies are what keep the lights on and keep these large organizations going so that we can see patients, but we are doing it in a way that I think is not very efficient and it's not very personal.
Yeah.
So we aren't able to really develop close relationships with patients like I feel
So,
like I did in my first couple of years.
yeah. So, yeah. So you covered a whole lot of topics, like a whole lot of layers of trouble that we
Yes.
have in our healthcare system. Um, so let me break this down just a little bit. So what do you think we're doing well in our healthcare system?
Hmm. So I think a couple of things have happened in the recent years. I
Yeah.
have seen some large organizations take on the like integrative medicine approach, and
Yeah.
within those subsets, we're seeing a provider that is primarily working on healthy lifestyle habits, talking about motivational interviewing and change theories. And then those providers are paired with like RN health coaches
Yeah.
and meet with patients like on a weekly basis. I think that is a turning point that has been relatively recent as far as in my experience with some large organizations.
Mm-hmm.
And the downside to that currently is that one, it's one provider and a couple of nurses. So how many patients can they see when that provider also carries their own panel? So it's not open to everybody.
Mm-hmm.
It's not considered preventative care for some insurance companies. So
Mm-hmm.
patients have a copay for these visits,
Mm-hmm.
um, which is unfortunate when people pay so much for a health insurance premium to not have these
Yeah.
preventative and health promotion activities be covered.
Yeah.
So I think that's something that we're doing well. We just need to sort of take it to the next step.
Mm-hmm.
Um, I think telehealth is huge, and one of the good things that came out of the pandemic and being able to increase access to care for so many people.
Yeah.
There's a lot of things that we can do via video, especially when you really have good relationships with your patients. You know their history well, you know them well, they feel comfortable with you. There's a lot you can get done with a conversation, and really listening and understanding. That's kind of
Yeah. Yeah.
the art of nursing, right?
100%. 100%. We tend the human responses to illness. Yeah. Uh, so, all right. So, and I totally agree with everything you've said in terms of integrative health is becoming more common and starting to see the human as a whole human. Because for a while, for decades, we started to compartmentalize the human into, like a heart, a kidney,
Mhm.
and then rather than seeing them holistically. And so truly, I do believe that is a major way that we're going to improve outcomes and ultimately reduce costs is when we start
Mhm.
to see the human again, back as a whole human. So they have the heart troubles and the kidney troubles. They also might have mental health troubles, or maybe they're obese and things like that. Um, Seeing them as the whole human and getting the team to communicate with each other. Because one of my gripes as a nurse was, dealing with Dr. A and
Mhm.
Dr. B, and maybe they have two different specialties, but they're serving the same patient. So why don't you go ahead and talk to each other, make a plan.
Mhm.
So I everything that you said, I totally understand and agree with. Uh, so what are some things that you see? Well, you talked about what we're getting better. What are areas that we can improve on that are like a measurable thing? So in the next, say, 5, 10 years, what would you anticipate that we could do in the healthcare system to improve it, to improve health outcomes specifically, and make it cost efficient for the patient?
Hmm. So there's probably a couple of different ways, and it may differ based on the community. But as you said, if we think about the person as a whole human being, instead of having these like, okay, see me for your diabetes, and then 2 months later, you're gonna come back and see me for your depression, and we're doing these in 15 to 20-minute visits. I think if we could do a better job if we had more time as a provider with the patient, so say every 3 or 4 months we have a 1 hour visit and we can actually encompass the whole person and everything that's going on. And then in between, when there are issues that arise, we can do those shorter visits. But really spending some time and educating patients in those longer periods of time, I think is one way we can, the patient feels heard, they're going to be more likely to understand their diagnoses and what kind of habits they need to be working on, and have better health outcomes, which in turn saves money.
Yes.
I think we could definitely use RNs. So, really, like if everyone's working to their highest capacity. So in a lot of places I've worked, RNs have been used for triage, which is wonderful. Like they're excellent. They can provide so much information for us. I have worked with so many amazing RNs that I'm like, okay, you've done 75% of my job. But those RNs can also provide education, they can provide coaching, they can provide, wound care when they're in the office. They're like, so this is one of my biggest gripes with the last few organizations I've been with is these people are such a big part of our healthcare system and solutions that we need to utilize them. I think on the other side to that, a lot of nursing, there's been so much burnout so that it has been tough to hire nurses, since the pandemic. So that's been kind of a tough position. But I do think if if we go back to those like 1 hour appointments with your provider, and then, is it once a week or once a month you're checking in with an RN, kind of go over everything, that helps that patient feel, better supported. We can pick up on little things before they become big things. So I think that's one way to address people that are already, dealing with chronic illness. And then I think preventative care and health promotion needs to become a bigger part of our healthcare as a whole. There's lots of, 30-year-olds that I see that, I haven't, seen a provider since I was a teenager. My last sports physical when I was 18, because they felt fine. But, if we can see patients, on a regular basis and talk about those health promotion activities, they don't come as a shock at 30, 35. And the same as when we see patients urgently for their first stroke at 45 or 50, or their first MI, and they're having these major events because they just haven't had health care. And so they have untreated, unknown hypertension and diabetes, that has led to these things. So I think that piece of it, from a structural standpoint, a systemic standpoint, like we need to make that change. And with long wait lists in primary care right now, I'm not sure how we do that. But I think that's something that's important.
Yeah. So, as you know, I'm a health coach, and so I'm working on a master's degree in Masters of Health Leadership, where I focus, and I'm on the last lap of that master's degree right now, where I'm doing a capstone project, directly related to how we can implement more health coaching, or whatever you want to call it, lifestyle management, for patients, so that they have better outcomes, and how ultimately it's going to help the system on the other end. It's a win-win-win scenario. So we have been reactive. That's what I hear you say. And I agree with that we've been reactive in terms of our health and wellness in America. I took care of a lot of, particularly men in the hospital that they didn't like to see the doctor, and then they had the heart attack, and so we have this history of being reactive. And so being proactive, to me, is to me, it's common sense. I think to nurses and to holistic providers, it's common sense, but
Mhm.
it's required in order to make the change. Of course, we have to talk about dollars and cents, you know.
Mhm.
So health savings accounts, flexible savings accounts, over the past few years now, they do reimburse patients for health and wellness coaching. Some of them do, not all of them,
Mhm.
but the insurance companies still, as you say, it's for some reason, well, I guess they don't have enough data. I guess that's the reason for it, is they don't have enough data to back up the lifestyle change coaching to demonstrate that it is effective. But the long and the short of it is they haven't reimbursed for it yet. So it's something that we're working on, you know, like going
Mhm.
down the pike. And conversations like this in America perhaps is going to help propel this sort of thing moving forward. So how do you see that the shape of healthcare, the future of health in America? So if we don't, let's say, if we don't start focusing more on preventative and integrative health, what do you suppose will happen to the health of America?
Yeah, it's definitely a scary thought, especially, we have the baby boomers, coming
Right.
up here, and then we have the number of providers and
Yeah.
nurses going down. So like
Yeah.
who is going to be taking care of these people? So
Right.
I think that's a huge concern.
Yeah.
Um, and then, if we have all these very sick patients or patients that require a lot of care,
Hmm.
and then we have the next generations coming up, and we're not focusing on prevention, and then
Hmm.
we keep doing this reactive sick care.
Hmm.
I mean, there's going to be nobody to take care of people.
Right.
So I just anticipate, like, we're already, on the lower end of health
Yeah.
outcomes when we think of developed countries. So kind of thinking forward of, are we going to get further down on that list, and people are going to have,
Yeah.
worsening care, worsening outcomes.
Right. Yeah,
Yeah.
I was reading a study by the Commonwealth, and it looked at 11 different factors or 11 different measurements of quality in the healthcare system. Compared America, have you read this study or something
I have
similar
not.
to it? So it compared America to some other nations, and some of them were socialized healthcare nations. And
Mhm.
America was on the bottom of most of these healthcare quality measures, you know,
Mhm.
even though we spend a whole lot of money, we spend a whole lot of money on our
Mhm.
healthcare. And we spend a lot of money on and I know this from personal experience, we spend a lot of money on the technology, we spend a lot of money on the machinery, um, and we've totally lost sight with just the relationship between the clinician and the impact, the powerful impact that you can have as a clinician, having that investigative conversation with that patient in terms of
Mhm.
the outcomes. We've totally, we, in my experience, people perceive it as an inefficient use of time to sit and
Mhm.
talk with people.
Right, because you have to get those, boxes checked. You have to drop these codes. It's like
Yeah.
there's so
Yeah.
many like to-dos in order to get paid, that it be like that talking experience, gets put last, or the provider does prioritize that, and then their day, their week, their month piles up, and then they start, sacrificing their own, self-care in order to give to patients. And then we have the other side of that,
Yeah.
of burnout, and providers leaving the field.
Yeah. 100%. Um, so I do want to talk a little bit about providers burnout and how providers, like clinicians, how they take care of themselves. So, in this project that I'm working on, nurses are overweight, obese. Doctors have a high level of stress. So, what do you think? So, I guess my question is, until we start to take care of ourselves, how can we expect to teach patients to take care of themselves? And that's a
Mhm.
troubling, it's a hard question to answer because of this stress and this time constraints that we have. But
Mhm.
have you observed that? And do you have a suggested answer to that? That's a big
So,
question. That's a big question.
yeah. Um, yeah, I often like when I counsel patients about lifestyle measures, it's always like,
Yeah.
what do you like to do? What
Yeah.
seems, reasonable? I'm not going to ask you to go work out for an hour a day. Let's talk about what you enjoy, moving your body.
Yeah.
So kind of making that entry really small to any, habit or activity.
Yeah.
And so, I always tell patients, I'm not going to ask you to do anything that I don't try to do myself. Doesn't mean
Right.
I'm perfect. I'm human, just like you.
Right.
Some days I do all the healthy nutrition things, and some days I don't.
That's right.
So, kind of reviewing that with both patients and providers. With staff that I work with, I always encourage time away from the desk. So many of us like work through lunch, we take work home. And so this was something I started doing maybe 5 years ago, that even if my charts aren't done for the morning, even if I still have tasks, like I need to just step away from my desk, even if it's only 10 minutes.
Yeah.
I try to make it a walk outside because, I'm getting the sunshine, I'm getting some nature, and
That's
I'm
right.
getting some movement.
Right.
So that's been something that's been super helpful for me personally, and
Yeah.
something that, staff that I've worked with over the years, like, hey, let's go for a walk. It's raining out. Okay, let's do the stairs, or let's just
Right.
step away and chat. Having some camaraderie and community, I think, can be helpful in that aspect.
That's huge.
Um, one of the other big things for me was wanting to fix this broken system we have and feeling powerless to do so.
Mm-hmm.
So kind of adjusting, what does fix mean,
Yeah.
to, what are the things that I can contribute to help make change that I know is going to be slow. So taking that step back, trying to avoid that negativity of
Mm.
the system's terrible. You could really
Right.
kind of get down into the doom and gloom of things.
Right.
Um, so yeah, kind of balancing the boundaries, having some time mixed into your day that's away from patient care,
Mm-hmm.
um, having support, whether that's from a colleague, a partner, or family member, someone that you can kind of talk to about your day.
Mm.
Um, and I think there's many providers have sort of the idea of perfectionism. And so when, did they make a mistake or did they miss something, kind of going through those things with a little grace, reflecting on it, how, was it a you problem? Was it a system problem? And then how can we, better meet those needs in the future? Um,
Yes.
so I think those are the big things. But again, it's like just like we would with our patients, it's the small thing. What can we do that's small every day rather than trying to jump into these big elaborate
Yeah.
changes?
Right. 100%. And I think ultimately that's how we're going to get there. I love the fact that you encourage a healthy work environment because it's going to naturally carry over to your patients. So your
Mhm.
staff they're going to feel that. They're going to know that they're taken care of, and that's going to naturally spill over to taking care of patients. I love that.
Mhm.
Um, so you're a family nurse practitioner,
Mhm.
and so you tend the community. So you tend mom, dad, you tend the child, you tend grandma, grandpa.
Mhm.
What do you love about how you serve, and what are the challenges?
Yeah, I love the relationship building, like
Mm,
being able to, see patients and see the whole family, kind of have that community aspect of things. Building through like understanding and trust. So certainly building trust with patients doesn't always come easily. So particularly if they've had poor experiences with healthcare providers or systems, or if again, it's been 15 years and they were a teenager the last time they were seen. Building that trust and kind of explaining how things work can be a challenge initially, but ultimately building that relationship where it's like you walk in the room and like it's an old friend, it's a family, like you can just kind of jump in where you left off. We can kind of just chat about how things are going. The fact that patients can tell me, oh, we talked about this last time, but I didn't do very well at achieving it, and it's not like, you're in trouble, you didn't do your homework,
That's right.
then we can talk about, okay, well, what do you think got in the way? And
Right.
so that aspect of things, I think patients appreciate. And I like to see those small wins. So, often patients will come in with a goal of weight loss, and instead we try to focus on like the habits. So when they come back and like, oh, I only lost 2 pounds, but I can point out like, but hey, you were exercising 3 days a week, or, you were eating, 5 vegetables every day, most of the days. Like, so kind of pointing those out to people so that they can see their own successes, which I think we often don't highlight how we are doing really some things very well. So I really like that aspect, and just like the pride that patients will come back with when they've done, like, I had no idea I could do this, and
Awesome.
what they did when we, like you said, it's common sense, it's the simple things, but
Right.
changing habits is not a simple thing.
Right. That is the most difficult thing. 100%. Yeah. Yeah. And building on strengths. I love that.
Mhm.
So, I know you had talked about, so any other challenges that you'd like to talk about in terms of serving as a nurse practitioner?
Yeah, I think like I said before about like the time. So
Yeah.
traditionally when patients ask about like what's the difference between a nurse practitioner and a physician, historically you've always had more time with a nurse practitioner. And that really has changed in the last probably 5 or 10 years, where our schedules are all built the same. So then, your experience can still be different because of the way we practice and the, that kind of understanding and education aspect that we really bring a little differently. But we don't have as much time to really dive in when we work in a traditional healthcare. So you have your 15 or 30 minutes to dive into their entire health, and then okay, well, traditionally you're going to just be scheduled in a year because you're healthy-ish. Rather than, okay, well, I know you don't have any major chronic conditions, but it's probably a good idea if we see each other more often. So sometimes that's getting the patient to buy into that idea. And part of it is, well, where can I put you in my schedule? Because I'm booked out with all these other patients who are much sicker. So, and while that I appreciate that we need to do that, that's part of how we can start increasing preventative care, is making room for those patients that let's focus on health promotion rather than sick care.
Right.
So I think that's one aspect. And then one of the other big ones is just the amount of patients a provider is expected to have on their panel. That can be 1,000 to 2,000 patients. So when one person is trying to provide care for that many people, it's sort of like, how are you going to be successful at that?
Right.
And so that kind of sets everybody up to be in a place where we're not providing the best care.
Right. Absolutely. So if people want to get in touch with you, they want to learn more, how do they do that?
So they can get more information about me on my website, mainlynp.com. I am also on Instagram and Facebook, mainly NP on Instagram and mainly NP Primary Care on Facebook. And then I have a couple of events coming up that are free for the community. And that's going to be, I'm calling it a coffee and tea talk. Will be like once a month. So this month it's going to be on April 16th at 9 a.m. And so that'll be in the office. So just an opportunity to meet me in person to see if you'd like me to be your primary care provider. And then I'm going to do a community nutrition talk on April 25th. So just kind of hitting the basics for people who are wanting to make some behavior change or kind of debunk the misinformation, all the flashy things we see on social media about this is what you need to be healthy. And then I'll have a grand opening on May 5th. And then my office is located at 27 Ocean Street, suite number 3 in South Portland. And I provide telehealth and virtual care. So if you're not living in this area, but you still think you'd like to connect, we can certainly see each other virtually for many things.
Sounds fantastic. So I will put all of that information in the description below so that people watching this video, they will be able to see where to go so that they can make contact with you.
Okay, wonderful.
So if there's one in closing, so if there's one message that you'd like to give to the community, what would it be?
I think it would be, so the fact that there is so much misinformation out there about, health and wellness, and there are a lot of people who have some significant chronic illnesses and maybe feeling like hopeless. I can't do that. I can't fix this. There's nothing that, kind of feeling helpless on what they can do. I think there are some general principles that apply to most people when we think about healthy habits and change, but the way we achieve those things can be very unique. So that way, you can make these changes in a way that kind of honors your goals and your values without having to do something that doesn't feel, quite right to you. And I feel like we have this one body, this one life, and try to take care of it in a way that feels good to you.
Awesome. Sounds great. Well, I will for sure be letting the community know that you exist and where you are. And I'll put all of your contact information in the description below. And thank you for joining us.
Great. Thank you so much for having me. This was great.